Let's look live at London because the concern over the variant certainly being felt there. It is not just the UK variant, but now the South African variant that has British officials concerned enough to launch a 2-week sprint of tests, a postcode blitz. They're looking at people in the capital and several other areas of England, trying to figure out just how quickly the variant is moving and to what extent. And the UK health minister is urging people in those regions to stay at home to help stop the strain from gaining a toehold. Tessa Arcilia is on that story. She happens to be in Brussels live for us this morning. But this testing, this blitz for 2 weeks, what does it involve, Tessa?
Well, Heather, it basically involves a door-to-door kind of testing, and it's interesting the words they're using. Blitz, surge testing, sprint. It essentially shows, Heather, the kind of rush they're at in order to clamp down on this so-called South African variant. So around 80,000 people in 8 identified areas in England will receive these home testing kits. We've seen volunteers, firefighters, health officials packing them together in order to bring them to those areas starting today. There will also be mobile sites where those tests can be done. And they're also planning to test sewage water. Now, in the course of this pandemic, this has been used as a method to identify the prevalence of certain strains of the coronavirus in specific geographic areas. This is important because it will help them identify where local transmission is happening. I mean, that is the concern, as we've been reporting, even in Canada, the local transmission of this, what is believed to be a more transmissible type of virus. Now, in the UK, most of the identified cases have been linked to external travel or people who have been outside of the country, but that has changed now. Let's listen in to the Health Minister, Matt Hancock.
We've now identified 105 cases of this variant here. 11 of those cases don't appear to have any links to international travel. There's currently no evidence to suggest this variant is any more severe, but we need to come down on it hard, and we will. We've already made sure that all these cases are isolating and that we've done enhanced contact tracing of all of their close contacts.
It is that number 11, Heather, that's gotten officials worried about how fast it is spreading locally rather than coming from the outside. And also the jury is still out, even if some scientists have said that maybe the vaccines could work. Well, we don't have 100% proof whether any of the vaccines that exist right now could be effective against these new variants. So, Heather, they are going down hard, as Matt Hancock said.
And how do the people in these postal regions, Tessa, how are they reacting to this? How do they receive this effort?
I mean, there's already, a lockdown in place in the country, and just more of testing, more vaccinations. Generally, that is received quite well. But clearly, it's being seen, the big picture is being looked at in the UK because more restrictions aren't necessarily as well received. But let's look at where the UK is doing well, Heather, in addition to this 2-week sprint, as they're calling it. Vaccination program, that is well praised because they have vaccinated close to 9.3 million people at this point. Over 90% of over 80s have been vaccinated. More than half of over 70s have been vaccinated and have received their first dose at least, and 500,000 have received their second dose. Now, some dismal numbers where they're not doing so well. We've seen the death toll at 107,000. The infection rate is still at 18,000, even if that has already gone down, and 3,000 hospitalizations a day. So ministers are also considering whether or not to impose that hotel quarantine on all visitors into the UK. Nicola Sturgeon of Scotland also considering that. So, Heather, they're going at this with all possible ammunition at this point, and this 2-week thing is just the latest of that.
Tessa, thank you very much. Tessa Arcilia with the British story for us today.